This is Dr. Gauri Agarwal, the Associate Dean for Clinical Curriculum for the University of Miami Miller School of Medicine, along with Dr. Joan St. Ange, the Senior Associate Dean for Faculty Affairs, and Dr. Yvonne Diaz, Associate Dean for Graduate Medical Education. We would like to discuss how faculty and residents can be prepared for more learners on the teaching teams during the COVID-19 pandemic. The pandemic has led to many changes in our health system, including the removal of medical students from the direct care of patients. However, we are planning on having our students return soon. Our soon-to-be fourth-year students will return on June 22nd to make up missed clinical time. Our new entering third-year students will begin clinical rotations on July 20th. We are in the process right now of screening all of our students upon re-entry regarding any exposures or symptoms they might have. In addition, they will all be trained on how the clinical environment has changed significantly, including adhering to hand washing protocols very strictly and the appropriate donning and doffing of personal protective equipment. Every clinical student will be mask fit tested and provided with an N95 mask, a face shield, and daily surgical masks, as well as goggles. They will be advised that cloth masks are not approved for use in the clinical environment and that they must wear a surgical mask at all times, other than at times when they're eating. We've also informed the students that each hospital partner and preceptor site could have additional requirements for them that they need to adhere to. The students are all aware of the hygiene protocols. We've informed them that they need to, as much as possible, avoid close interaction with others or surface contact during their commute to and from school, while they're entering or exiting any buildings, while they're riding in the elevator, using any common areas, going to the bathroom, and moving on stairwells. Students will be advised to not touch stairway railings or elevator buttons with their fingers. And the bathroom ideally should really be one person at a time using the bathroom. And students have been advised to not take personal belongings like cell phones into the bathroom. We've told them to avoid bringing in their white coat and avoid any necktie use, and to wear clothing that can be easily laundered, such as matching solid colored scrub tops and bottoms. They have been told to bring a minimal amount of personal belongings, such as purses and backpacks, and to not share personal devices such as laptops, cell phones, pens, or pencils. They will be provided locker space in the Rosenstiel Medical Science Building for any personal belongings. They've been advised to sneeze and cough into their elbow and dispose of any tissue after one use. In terms of appropriate patients for students, they are not to see any patients who are known to be positive for COVID-19 or are under investigation for COVID-19. Students are allowed to see all other patients in all other clinical environments as allowed by our hospital partners and teaching faculty. If students have been exposed to a patient with COVID-19 or if they become symptomatic, they must contact our 305-243 test line or 305-243-8378. In addition, they've been told to notify our student services deans on both campuses. On our Miami campus, that's Dr. Halit Machaber, and on our regional medical campus, that's Dr. Amy Zito, and you see their email contact there for your reference. Physical distancing measures will be challenging when students return, but it must be optimized when possible. Direct patient care, including rounding with medical students, residents, and other trainees, sometimes requires proximity between members of the team that is closer than 6 feet of distance. This is acceptable when all team members are appropriately using masks and other PPE. At times, workspace may be limited, including computer availability, so students have been advised that they have to bring their own laptop or tablet device daily to campus. In terms of the work of pre-rounding and rounding, attending should encourage their teams to divide into groups of 2 to 3 to pre-round for work rounds so that they can maintain physical distancing and round effectively. You can think about parts of pre-rounds that can be done entirely remotely, such as reviewing patients' vital signs, ins and outs, medication lists, and nurses' notes. Try not to pre-round on any patients that are requiring contact precautions so that the team just has to see that patient once during attending rounds and not waste any personal protective equipment and pre-rounding. For attending rounds, teams should consider presenting patients via Zoom or traditional sit-down rounds if appropriate physical distancing can take place. Sit-down rounds could potentially be combined with 3 to 4 members live in the team room while others Zoom into the session. You can set up a recurring meeting in Zoom for the team to help facilitate this. Once sit-down rounds are complete, the challenge of maintaining these distances becomes more problematic as one has to go to the bedside. Our recommendations are that when you go to see a patient, there should be a maximum number of 4 team members who enter the room. This should include the attending, 1 resident, either the intern or sub-I, and the student caring for the patient. These are recommendations assuming that physical distancing can reasonably be achieved in the space allotted. Faculty and residents can and should adjust the number of learners that enter a room if it's a small and confined space. Some smaller rooms may only allow for 1 or 2 learners to enter the room of a patient with the attending. Of course, face masks and other appropriate PPE should be worn, and careful and strict hand washing should be followed by every member of the team prior to entering the patient's room and when exiting the room. If it's possible and appropriate for your patients, you can consider asking patients to wear a mask while the team is rounding. This may not be possible for all patients, particularly if they have NG tubes or other devices in place. Gloves should be worn if appropriate for that patient, especially if you're going to be in contact with bodily fluids, but this does not replace appropriate hand washing. You should plan the protocol for each patient ahead of entering the room and decide who will take the lead in history taking. The attending can observe the interview and, after examining the patient themselves, step back to allow other members of the team to perform the physical exam. Team members should try to physically distance from each other as much as possible in the room and approach the patient one by one to perform the physical exam. Team members should clean their stethoscopes if used between patients and try as much as possible to examine only the pertinent areas on the physical exam of the patient. Are now going to demonstrate this.
To tell you about before we get started, really the focus, I want you to have a great time, but first and foremost is your safety and the safety of others. So a couple of rules for the road. First of all, make sure that you all washed your hand before you got here, so please give me your hands. Let's do this washing correctly. All right, remember what you learned during our patient safety week on how we actually wash our hands. We do so for 20 seconds, as you all remember and learn. Excellent. Second rule for the road, masks have to be on at all times. Please put your mask on. All right, I know it's hard sometimes to do that when you're on rounds, but they need to be kept on the entire time when we are together. Okay? The third thing is to remove our lab coats. All right, these things are a source of infection. We will not be using them on rounds. And please make sure you put on your eyewear when you're doing clinical care in particular. And last but not least, no food and no drink should be allowed during rounds. That increases the risk. Actually, that's not the last thing. The very last thing also is I need for you to separate when you're on here working with us together. So if you could separate a little bit, that would be very helpful. All right. I think that's it, and we're ready to go. Any questions? All right, let's go. Okay, so we're going to be going over the patients now, and also I want to remind everybody that as we go into the rooms, we need to wash our hands. And I also want to remind everybody that we need to be cognizant not only of what we do, but what each of you does. So if I take my mask off, or if I forget to wash my hands, I need you to tell me. If you don't do what you need to do, you need to feel comfortable telling him as well. So we're going to work together and make sure that we all stay safe as we go through the month. All right? Okay.
Rounds are one of the most important parts of a third year, fourth year, and residence day. In order to social distance and maintain appropriate safety while in the hospital, there are a number of things that we advise you to do. One, set up the scenario before you go into the room. Who will interview the patient? Who will examine the patient? Where will the attending stand? And how many people will be in the room with you? We advise that only a maximum of 4 people come into any patient's room. That would include the attending, the resident, an intern, and a third-year student. The rest of the team can stay outside of the room as they have already reviewed the pertinent parts of the patient's history and physical and progress for the day. So we'll demonstrate this with our team.
Okay, guys, before we walk into the room, I just want to remember how we're going to run this. Hazel, you're going to take point on the interview piece. And Catalina, you'll be doing the physical examination. And Marco, you can observe with me at the head of the table, so we can allow them to take the leads on this. And lastly, Jennifer, I need for you to wait outside, and you'll come with us with the next patient, which is yours. Okay?
Thanks, Dr. Diaz.
All right, well, let's go in.
Oh, doctor, don't forget to wash your hands.
Oh, okay, thank you. Let me put these on too. All right, Mr. Jones, my name is Dr. Diaz. I'm the attending on service today, and I'm going to let our intern and medical student lead the conversation. Hazel?
Hello, Mr. Jones. How are you doing? My name is Hazel Laguna. I'm an intern, and here we have Catalina Gonzalez, who will be doing a assessment on you.
Any change, Catalina, from yesterday?
No, it sounds the same.
Okay.
Okay, Mr. Jones, so depending on how you're doing, we're going to go ahead and reduce your Lasix and potentially discharge you tomorrow.
Great, thank you very much. Okay, so let's move on to the next patient, okay?
Remember that masks must be used in any area where students and residents are gathering, such as team rooms and lounge areas. In these areas, physical distancing must continue to be applied. Markers have been placed in many areas around our health system to indicate appropriate physical distancing, and team members should adhere to these recommendations. It's a good idea after rounds to run the checklist with students and have scheduled times when you're checking in with students, as they may not be physically present in the team rooms given these physical distancing measures. Schedule a check-in at the end of the day to go over any final notes and the plan for the following day. Everybody in our healthcare system, students, faculty, staff, residents, must understand that they're not simply responsible for following safe practices themselves. They're also responsible for ensuring everyone around them does as well, in the interest of their own safety as well as the safety of others, including patients. When you see anyone violating safe practices, please just remind them of the proper protocol with the polite please. For example, please remember to wear your mask. Those receiving such a message have to remember that there's only one really permissible response to this: an immediate thank you, followed by compliance of the recommendation, such as wearing the mask. This needs to be reinforced by team attendings on the first day with your teams and as needed to reinforce this culture of safety for our entire health system. We hope overall this has been helpful, and we look forward to hearing any feedback once students are back in the clinical environment, as they're important members of their healthcare team. We thank you all for the tremendously important work you're all engaged in, caring for our community at this time and educating our students and residents. If you have any questions, comments, or feedback, feel free to email any one of us at the email addresses you see on this slide. Thank you very much.